just try to work with it. Getting back to the electronic medical records is my favorite topic. Because, I've actually had quite a bit of feedback from that article I put in the Gazette with regard to electronic medical records, because I'm kind of opposed to the way it's rolling out so quickly and kind of being forced. We've got certain dates that we've got to meet and be able to do this and that electronically, or we're not going to be reimbursed. So obviously we're going to play the game because we know how to do that. I talked to several physicians that got several letters and emails with regard to their thoughts on it. I talked to a doctor today, and he said, I do beautiful documents. I take pride in the accuracy of my physicals and the H&P, the documents, the resumes, and he said they've been available electronically for over 10 years. A patient of mine comes into St. Luke's emergency room. They've had this available electronically. He said, do you know how many times they refer to my beautiful documents that I have there on these patients? He goes, I don't think they've ever looked at them. He said, they don't have time. They're not going to look up those documents and read all the details that are available. I do think electronic records is going to help. I'm not completely against it. I'm just worried about how fast it's moving, and there's been growing pains. The examples that I give in the paper were real. I wasn't there in the exam room, but she was, and she was telling me about it. She said, he didn't look at me. He was too focused on his computer. And she was upset about it. And so that's what I regurgitated in my story. And so I think we're using electronic medical records now. We've been filing electronically to Medicare for a long time, years. And we have a state-of-the-art X-ray system. It's beautiful. I love it. We take X-rays, and by the time the patient gets down the hall from the X-ray unit, I have it on a large flat screen, and most of the time, within 5 minutes, I have a radiologist's opinion on it. I used to wait 3 or 4 days. So it's not like we're horse and buggy. We're moving along this electronic medical record, but I don't think that it's going to save a lot of money. And I would like to comment also, or expand on what Bob said about us being a $350 million or million-person country. That's very true. And it's almost maddening to say, well, we've got the most expensive health care, but we're 19th in this survey on overall health, which includes longevity and neonatal survival method. And the reason we're 18th is not because of the medical providers and the poor medical care we're providing. The reason we're at 19th is we live in a free society. People are allowed to smoke. Women are allowed to smoke when they're pregnant. And countries like Sweden, again, the homogeneous population, they got their thumb on it. It's not as free a society as we live in. And so there are costs to living in a free society. We can choose to ride a motorcycle without a helmet in this country. We can choose to smoke, and so the price for some of those freedoms is a lot of that stuff isn't good for you. The price is poor health sometimes.
All right, another question out there.
Yeah, I wanna respond to his on the Medicare and doing Medicare plus type contracts. Those types of HMOs that do that, which restrict the number of places you can go, and they do it because the cost is less. And anybody who's dealt with me knows that I'm not in favor of them, because they do restrict costs. You get what you pay for. Buy a hamburger, and nothing against McDonald's, but you buy a hamburger at McDonald's, or you buy a hamburger up at Gundry. There's a big difference. Not so much in the cost, but what you're getting. And some of those I do disagree with as far as what we're trying to do. What Dr. Meeker said on homogeneous groups, and this goes back to Part D. We're in a 7-state region. Minnesota, Iowa, North Dakota, South Dakota, Nebraska, Wyoming, and Montana. 7 states, biggest area you can ever find. It takes 2 cities to make a million, that's Minneapolis, St. Paul. Nobody else is even close. And it is a more homogeneous group. Take a look at those 7 states, it's a homogeneous group. Why is our premium for Part D the cheapest in the entire country? Because of that. I don't want to subsidize. I'd rather have it stay in states. I don't want to subsidize because some doctor has to pay more for his parking spot than Dr. Meeker pays for rent on his whole building. And so I don't want to subsidize them for anything. And we do enough of that. I think that sometimes when we need to look at that as far as when they put our country down, as far as saying we're 19.
Okay, still want to stay out of the weeds if we can. Go ahead. You got a question? Yes, ma'am.
Yes, I was going to ask if anyone thought that perhaps we could simplify all our paperwork that's involved in filing claims. I know now that there's new patient advocacy starting up that takes a look. If you think you've been charged too much and your insurance company isn't going to pay it all, then they will, for a fee, like a lawyer's fee, look into it, and they're finding out that they're recovering lots of duplicated things like in hospitals. And I have found a lot of mistakes that have been made, and I feel like I'm kind of troubleshooting sometimes my claim. And it does get worked out in the end after I pursue it, but I just think that when we left a doctor's office or a hospital with an itemized statement so we knew what we were being charged for, it would even make that easier for me to troubleshoot what the insurance company, their explanation of benefits is not a very simplified explanation. It's just a general, Medicare paid this, we paid this, you owe nothing.
Okay, Mike, you want to grab that one?
So are you talking about your problems from the insurance perspective or from the
It's
billing
just-
office perspective?
I'm talking about any healthcare provider that files your claim for you to the insurance company. I noticed a lot of it happened when that started. When I used to fill out my own, I knew what it was. I was handed a bill from the doctor's office, the clinic. I filled out the claim, mailed it in, covered under my school insurance, and I knew what was paid. I knew what was covered because I read my policy and what I would have to pay for before I even sent it in.
Yes.
And now I have no knowledge of that. What I'm charged for, I have no statement from the insurance company that says exactly what they did or did not pay for. I just have to assume they paid for everything that's covered.
We can certainly give you an itemized bill of what we did for you. So if you ever needed that, we can certainly give that to you. Are you getting an explanation of benefits from your insurer? And that's probably all that's saying is just that you visited the doctor on a certain date, or you visited on a certain date, but it doesn't.
But it just seems kind of senseless to have these patient advocates out there collecting money for something that should be simple enough for the patient to do.
Yeah. Once again, if you ever have a question about your bill with us,